Good afternoon, and thank you for joining us for today's virtual media briefing on COVID-19 in London and Middlesex County. We're happy that you could join us. A welcome to the media in attendance this afternoon, and a reminder that if you are new to our virtual media briefings, if you could click on the question icon here on Microsoft Teams if you do have a question, and when you do submit that question, if you could indicate your name as well as your media outlet and who your question is for. I'd like to welcome our guests as well, Mayor Ed Holder from the City of London. We're also joined by Ms. Carol Young-Ritchie, Executive Vice President, Chief Nursing Executive and Chief Clinical Officer at London Health Sciences Centre, and Dr. Chris Mackie, the Medical Officer of Health at the Middlesex-London Health Unit. Normally we would be joined by Warden Cathy Burghardt-Jesson from Middlesex County, but she is not able to join us today. While we're on the welcomes, welcome to those who are tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are watching on the CTV London website. Let's get to our opening remarks for this afternoon's briefing, and we'll start with Mayor Ed Holder.
Well, thank you, Dan, and good afternoon, everyone. On Friday and Saturday, bylaw enforcement, along with inspectors from the health unit, partnered with the province as part of a multi-agency compliance blitz. A variety of premises were inspected over those 2 days, and I can tell you charges were issued. The province is in the process of finalizing the inspection results, and we'll have more information in the coming days. As well, our London bylaw enforcement responded to noise complaints in neighborhoods near Western's campus over the weekend, and 2 illegal gathering charges were issued, and further charges are pending. You know, at this point, we haven't seen the flagrant rule breaking in London that was on display in places like Elmer and Tilsonburg over the weekend. And for that, sincerely like to thank our local businesses and outdoor recreational operators for abiding by the provincial guidelines. Regardless of how you may personally feel about the rules, and I know it's tough, they are the law, and now's not the time for civil disobedience when we are still seeing high COVID case counts in London. And did you know that as of tomorrow, our COVID results, which really will be the result of today's numbers, the London region will hit a milestone, a tragic milestone of 10,000 people infected by COVID since the pandemic began. Beyond that, I'd like to encourage faith-based leaders in London and heads of our community groups and various associations to reach out to your members and encourage those who are eligible to get vaccinated. This is an important issue and it's critical. I know the health unit is working with the London Public Library and Middlesex County Library to reach out to people, particularly over age 70, to make sure that they aren't left behind. But this really requires a full press from the entire community. Do you know that right now it's estimated that more than 80% of those over 80 and 65% of those between 70 and 74 have already received their first dose? That leaves a lot of people in the gap. But I'm confident with the help from the libraries, along with our faith-based leaders, our community groups and local associations, we can drive those numbers even higher. So sticking with vaccines, and pardon the pun, I know today earlier, Health Minister Christine Elliott said the province is strongly considering a recommendation brought forward by the province's Science Advisory Table to allocate roughly 50% of its vaccine supply to COVID-19 hotspots. That's twice the amount that's already been allocated. And I must say, I'm not at all supportive of a change in policy. Look, I understand the challenges being faced in some parts of the GTA and elsewhere, but so-called hotspots can change in a very short period of time. Just look at London, where N6A was a hotspot recently and today it is not. I absolutely do not want to see London risk becoming one by diverting even greater supplies of local vaccines elsewhere. As mentioned, additional vaccines are already being sent to hotspots, not to mention we are receiving patients from elsewhere in our ICUs. That's not what's required right now. It's also the moral thing to do. Allocating up to 50% of provincial vaccine supply to hotspot neighborhoods is just a bridge too far for me, and it's not something I can support. Let me give a shout out to Minister Jeff Urick, who communicated with me earlier today about additional vaccines that are going to be coming to London in support of Indigenous communities and other vaccines that in the short term are coming. That really does matter. I would like to see that momentum continue and go forward. And finally, you know that in our downtown, you are seeing an extensive amount of construction, also in Old East Village. So here's what I'm going to ask you to consider. Next time you're grocery shopping or looking for takeout food, consider the market, consider King Street, consider downtown, consider Old East Village. And I know I would honestly say consider taking dine out wherever your favorite place is. Because if there's a time where they truly and sincerely need your help, it is right now. So London, let's do what we always do. We come together for a greater good. We'll support our local folks, and let's not forget our downtown and Old East Village. So that's it for me, and I'll turn it over to Dr. Mackie. Thank you.
Thanks very much, Mr. Mayor. So we are reporting 100 cases here locally today, no deaths. The province is just under 3,500 as well. These are encouraging numbers, but I want to stress how tentative our recovery looks at this point in terms of declining case counts. And that's primarily because we're seeing declining testing happen, more so at the province than locally. But if you look at percentage positivity, it's really not coming down to the same degree as testing. In fact, provincially, percent positivity is going up. Now, locally, it's great to see the numbers not where they were 2 weeks ago when we were peaking. But with the post-secondary students from Western moving out of the community, that accounts for a significant part of the decline. So I think it's really important to recognize we still have extremely high rates of COVID spread in our community, as high as it has been at virtually any time since the very beginning of the pandemic. Same thing is true at the provincial level. The percentage positivity continues to climb at the provincial level. Case counts are down primarily at the provincial level because of reduced testing. And that is partly reduced testing in schools. But again, percent positivity is increasing there. We're not out of the woods. We're very much in the thick of things. It is notable, we are seeing signs of reduced activity in the community. There are less cars on the road. There are definitely less gatherings happening, which is very positive. Our case contacts still have a significant number of contacts, but that is trending down, so that's encouraging. On the vaccine campaign, things have been moving very well there. We have longer term allocations of vaccines. We'll hit sometime today 150,000 cumulative doses administered through the mass vaccination centers. It's a tremendous milestone. And you'll recall it was just a couple of weeks ago we hit the 100 vaccines given milestones. So to be hitting 150,000 today is really, really tremendous. We also have better visibility around the long-term allocation of vaccine across our community. Really not much Moderna happening. We do expect a delivery on May 3rd of about 8,000, but not much beyond that. In terms of Pfizer, the doses that will be delivered this week are down significantly from last week, and about just over 9,000. But those come back up next week to almost 13,000, and then we continue for another week at that level, and then we see big jumps. We know that the province and the federal government have been able to acquire more Pfizer vaccine for the May period. We know a big chunk of that is going to hotspots, but some of that will be coming here mid-May as well. That will really help our campaign. We also know that those doses will only increase in June, and so we're looking right now about how they get allocated across the 3 mass sites that are currently operating, and the 4th that we will likely open sometime in the next month to be sure that we're ready for those large numbers of June vaccines coming in. We're now up to 9 primary care sites with another 16 primary care sites ready to go. There are about 40 family doctors represented in those 9 sites that are currently operating with lots more ready to go. And that continues to expand. We'll be moving out to all family docs who are interested sometime over the next month or 2. On the pharmacy front, we now have more clarity around the doses coming into our community. We have been allocated for AstraZeneca 21,400 doses of AstraZeneca for the pharmacy system, which is great. It's right on par. You'll recall we predicted it was in the range of 20,000 doses, and then we still only have 5,700 for family doctors, but hopefully more coming in there soon as well. Dan, I'll pause there. I can see we've got questions coming in already, but before we take questions, Carol Young-Ritchie from LHSC is going to say a few words.
Good afternoon, and I appreciate the opportunity to join today's briefing and update on the COVID-19 situation at London Health Sciences Centre. This morning, we reported 90 COVID-19 inpatients, and 37 of which were in our critical care. These numbers were recorded at 3 p.m. yesterday. As of this morning, we've been caring for 97 COVID-19 positive patients, 43 of which are in critical care. Of the 97 patients, 64 patients are from within our region, and 33 patients have been transferred from outside of our region. The numbers demonstrate we are continuing to care for consistently high numbers of COVID-19 positive patients from within our region, while also continuing to support the province with its effort to load balance patients across the broader hospital community. While our numbers aren't increasing at the same intensity as they were in the last couple of weeks, I want to be clear that capacity across the healthcare system continues to be challenged. In support of patient care needs across Ontario last week, we shared that we are once again increasing our critical care capacity by adding 7 additional beds. These beds will not only be opened as they are needed, and we will be prepared to respond as the situation evolves. We also shared last week that we are making further reductions to non-urgent surgical activity in line with Directive 2 from the Ministry of Health. We regret that some planned surgeries and procedures were rescheduled as a result. Any patients who are affected will be contacted directly by their healthcare team. Despite these temporary reductions, please remember that our hospitals are safe and our emergency departments remain open. Do not delay seeking care if you have a medical emergency. We are here for you and we have the capacity to care for you. Lastly, it's important for us to ask our community for continued support. We are not yet out of the woods and we continue to be challenged in these next weeks. Please continue to follow the stay-at-home order and public health guidelines. And if it's your turn to be vaccinated, please don't hesitate to book an appointment. Thank you.
Thank you very much, Carol. Thank you, Dr. Mackie. Thank you, Mayor Holder. All right, we do have a lot of questions and we're going to get into those right away. So let's start. The first question, Dr. Mackie, is for you, and it comes from Jennifer Beeman at the London Free Press. Dr. Mackie, there are reports the province is planning to increase vaccine supply to hotspots further. Are you concerned about a reduction in supply here? I know you talked about some of the expectations over the next few weeks. How would the health unit handle a cut? Would it cancel appointments, schedule fewer, or possibly close a vaccination site?
Yeah, thanks for the question, Jennifer. We have been careful about how we schedule appointments. We have a system where we're now scheduling out 4 weeks of appointments, but for that third and fourth week, we're not scheduling 100% of appointments. That gives us both the volume of appointments to get people booked and also the flexibility to reduce or increase appointments as we need to as we get closer to those dates. So that means we haven't had to cancel any clinic appointments. We have not had to rebook due to vaccine delays or reductions. So from that perspective, we're managing on that front, and we believe the next few weeks won't be an issue. I understand the province is making hard decisions right now. This is rationing. There are winners and losers, and there's really no way around that. And simply spreading vaccines equally doesn't necessarily make sense when there are communities that are being much harder hit. So from that perspective, I understand what the province has done. We just look forward to getting more vaccine here when we can.
Thank you very much, Dr. Mackie. Let's go to the next question. And this one is for Ms. Young-Ritchie from Jennifer Beeman at the London Free Press. Has LHSC had to put any adult patients in the 3 pediatric ICU beds yet?
Thanks, Jennifer, for that question. No, we haven't had to put adult patients in our pediatric critical care unit. We did mount extra capacity last week, and those 3 beds are part of that capacity, and we haven't had to use it yet.
All right, and we do have a couple of follow-up questions from Jen Beeman for you, Ms. Young-Ritchie. The next one is, how many out-of-town patient transfers is LHSC expecting this week? Will it be adding additional ICU or acute care beds? And I think you did mention a little bit about that in your opening remarks.
Yes, so generally that's assessed every day. Generally we count on expecting between 2 and 6 patients every day, and we will continue to do that likely over the next week.
All right.
We're continuing to look at our ICU capacity too and making sure we're ready for those patients.
Thank you. Sorry for jumping in there. Jen does have a couple of other questions. LHSC was already reducing surgical capacity before the province's latest directive to halt all non-urgent procedures. What is LHSC's surgical capacity sitting at now, and by percentage?
Today, we reduced gradually over the last couple of weeks, and today we're getting down to around 50% capacity.
Terrific. And here's the last one on this stretch. LHSC already has some staff reinforcements who have come in from St. Joseph's, as well as the Middlesex Hospital Alliance. Will LHSC be receiving more of these reinforcements? Oh, you're on mute, Ms.
Oh, sorry, thank you. Yes, we're very thankful to have the staff come and join us from those 2 hospitals. And we're looking at this as a system. So we are looking at our redeployment plan as we ramp down some of our surgeries and where the skills and expertise that we can redeploy staff to. So currently we haven't asked for extra staff, but again, we continue to evolve the situation and look at our staffing needs and address that as a system.
Thank you very much. Next question is for you again, Ms. Young-Ritchie, and it's from Steve Young at CTV London and News Talk 1290 CJBK. Do you have any information about those who are in ICU at LHSC recovering from COVID, about whether they had traveled from out of the country prior to becoming sick? Do they make up most of those who are in ICU? And by most of those, I'm guessing the COVID patients.
So I don't have that level of detail, actually. So we do have, as I said, 43 patients who are in critical care, and and about 26 of those come from outside the region. I don't have that specific detail if they've traveled.
Okay. Let's go to the next question. Dr. Mackie, this one is for you. It comes from Andrew Graham at Global News Radio, AM 980 CFPL. Dr. Mackie, last week you mentioned hopes of expanding local vaccine eligibility to a portion of the at-risk population. What update can you provide on that potential expansion?
Yeah, thanks for the question, Andrew. I appreciate it very much because things seem to be shifting in that regard. The same provincial call on Saturday morning that gave us the revised vaccine updates also indicated that the province may be shifting to more of the age cohort strategy than the at-risk strategy. What that would mean is that we would move to 55 to 59-year-olds before moving to that large group of at-risk healthcare conditions. We don't have clarity on that. There is a meeting this evening. We hope to hear more, but we will be able to announce that either tomorrow or Wednesday.
The next question is a follow-up from Andrew Graham, and this was one that I think he wanted to ask Warden Burghardt-Jesson, but he asked if I could ask you instead. So Dr. Mackie, have you heard any concerns from residents in Middlesex County about transportation challenges with regard to seeking vaccines, particularly in the population over the age of 70? Is more needed to help reach these individuals?
So we get a lot of complaints. I get a lot directly. We get a lot through our vaccine booking systems and elsewhere. I haven't heard any direct complaints to the health unit about transportation for reaching the mass clinics. That said, the warden certainly has raised this, as have other members of municipal councils, county councils, and lower tier municipalities in the county. And so what we've done is several prongs to our response to make sure the vaccines get out to the people who live in the county. First of all, we've successfully advocated in partnership with the warden and with the mayor for expanded vaccine access in pharmacies. In fact, we advocated for every pharmacy in Middlesex County that is able to give the COVID vaccine to be able to do so. The criteria the province uses is pretty simple. If the pharmacies are involved in the annual influenza shot campaign, then they're eligible. Not all pharmacies will be chosen, but that's the eligibility criteria. And all of the pharmacies that are involved in the annual flu shot campaign in the county of Middlesex now have vaccine available. So we're very happy that that's happened. And of course, that means there are pharmacies in every single lower tier municipality in the county of Middlesex that are offering COVID vaccines. The other strategy, of course, we have the Mount Bridges Mass Vaccination Clinic. We've committed to keeping that clinic open and maximizing use even when supplies may be short. And so we see that clinic operating at full capacity, 600 vaccines per day, which by the way is above the 500 that we initially had planned it for the foreseeable future. We also are working with family doctors. We already have a primary care site in Strathroy that is able to offer the vaccine and looking to expand the primary care facility access throughout the county as quickly as possible, as soon as those providers are ready and willing to do so. So that's our campaign. The other aspect that we are involved in is through the mobile clinics. You'll recall that's how we vaccinated residents in long-term care and retirement homes. That mobile campaign is continuing, and we have sites across all the municipalities in the county that where we'll be visiting. These are congregate care settings or congregate living settings where it might not be a retirement set or a long-term care facility, but it might be a respite home for people with disabilities, or it might be a even an apartment building that is tailored to seniors. We'll be visiting those sites and offering vaccine on site. Those are the folks that are least likely to be able to make it to our mass sites, and so of course we're going to them. The other prong of that campaign that is also in place now, just sort of starting this week, is working with the LIN staff. This is the home care staff, former CCAC, where you have chronic home care, and those LIN staff now have access to vaccine, so they'll be going door to door to the patients that they visit at home, and that obviously will take some time. It's very labor intensive to be traveling to deliver the vaccine, especially since you have to wait 15 minutes after giving the vaccine to make sure the person is not having an allergic reaction. But that is in place now and will be starting this week. So lots of different aspects, and really, as with all public health services, we are doing our best to reach absolutely every corner in the county as we can, just as we do in the city as well.
Thank you very much, Dr. Mackie, for that very comprehensive answer. There's a lot going on in the county and with the efforts to get folks vaccinated. The next question comes to us from Jane Sims at the London Free Press. Dr. Mackie, this one is for you. And there's a similar question from McKinley Leonard Scott at the Middlesex Banner. So I'm going to try to combine these two. A golf course near Tillsonburg opened up for business over the weekend in defiance of the provincial order. Now, Jane is saying she realizes this isn't in Middlesex-London, but Dr. Mackie, can you make any recommendations to owners of recreational businesses who might be thinking about following that golf course's lead? And then further, for McKinley Leonard Scott, from a public health standpoint, was the closure of outdoor activities such as golf courses a concern to you? Is closing down those outdoor activities counterproductive?
I appreciate the questions. Let me start by saying that facilities in London and Middlesex have been incredibly diligent at following public health guidelines. They've respected lockdown, they've respected shutdown, they've respected local orders. There have been rare exceptions where minimal education is all that's required. We really haven't seen businesses revolting with their actions against any of the restrictions related to COVID. Certainly there are businesses that are upset, and we completely understand that, but the businesses have also respected the regulations. So we haven't seen that in any significant degree. And again, minimal education needed where needed has been all that's been required. What would I say to those businesses that are considering this? I would say do your math very carefully. These penalties are steep. We will be absolutely diligent in imposing those penalties, and they accelerate and they can be levied every day that there's a non-compliance. And if we had to take additional measures, so there's some places where a business has taken an action like this in countervention of provincial regulations, local medical officers of health have issued specific Section 22 orders to those businesses. We would do the same. There are multiple levels of penalties. It's really not worth it.
Thank you very much. Let's go to the next question. Kate Dubinsky from CBC London, Dr. Mackie, is asking, Alberta is going to start vaccinating its meat packing employees this week with Moderna. I'm wondering if we're going to start to do that, particularly in large workplaces such as Cargill.
Certainly, we've had a number of workplaces come forward. A number of workplaces have indicated that they could offer this sort of campaign if they had the vaccine. We're looking forward to being able to do that. That's part of late phase 2, which we're not in right now, around people who can't work from home. Right now, the kind of mid phase 2 is still focused on age cohorts and healthcare conditions. We hope that we can offer vaccine to people who can't work from home within the next month at the latest, but this really depends on provincial direction and supply.
Thank you very much, Dr. Mackie. The next question is also from Kate Dubinsky. This one is for Carol Young-Ritchie. Ms. Young-Ritchie, what are the age ranges of those patients in hospital and in ICU?
Thanks, Kate. I don't have exact detail on the age ranges. I will tell you we don't have any patients in our pediatric critical care unit who are COVID positive, and I don't have further detail on the age ranges.
Thank you very much. And another follow-up question for Dr. Mackie from Kate Dubinsky. This is I guess a technical question. Dr. Mackie, if someone is transferred to London from elsewhere and dies in hospital, are they counted as an MLHU death or in their home health unit region?
Yeah, thanks for the question, Kate. Cases and deaths are counted by the location of the individual's residence. So we often have cases that are reported through the hospital or lab system, people who live somewhere else and are getting treated here. We refer those cases to the appropriate health unit to investigate and or to record. And that's part of why you see our data jumping around a bit. Sometimes you'll get, the daily count being 100, for example, today. Although our case counts went up 101, that's because we would have had a case referred out to another facility or in, and that happens almost every day, but it's in that range of 1 to 3% of cases.
Thank you. And Dr. Mackie, a follow-up here again from Kate Dubinsky. When librarians in London and Middlesex County are helping seniors, are they helping make appointments by phone or by website? And is the health unit looking at somehow helping to provide transportation?
Yeah, incredibly grateful for the support of the London Public Library as well as the Middlesex County Library. This is a really exciting partnership where we have partners that have deep connections in with the people who are in those older age cohorts that we're trying to reach, and are willing and able to mobilize their staff to reach out to the individuals in question. The county staff will be working through the website, so they'll be reaching out to people on their membership lists that are in the age categories that we're currently vaccinating. And what they'll be doing is notifying them, making sure they're aware that they're eligible for vaccine, and then offering the assistance that those individuals may be needed. They won't be connected into our phone booking system. They will be using the online system and provide any support that the individuals might need. So huge thanks to Middlesex County Library and London Public Library for being willing to partner on that. And also big credit to Dr. Alex Summers, who was instrumental in pulling that partnership together.
The needle or just
The next question, Dr. Mackie, is for you, and it comes from Emily Taylor at Western Gazette. Hi, Dr. Mackie. With students moving out of Western residences, are there any new cases associated with those outbreaks? Dr. Mackie, you are on.
Thanks for the question, Emily. Yeah, we haven't had a lot of cases in those outbreaks recently. I'll just bring those up in my view here. Yeah, it really hasn't been. It's been quite a while. So the London Hall, we're at 10 cases. Firth Hall, we're at 31 cases. Essex Hall, 12 cases. Delaware Hall, 20 cases and one person under investigation, PUI. Then Elgin Hall, 15 cases. Medway, Sydenham, 34 cases. Saugeen, Maitland, 55 and 3 probable. Ontario Hall, 18 cases, and that was declared over yesterday. So that's great news there. Really not much happening there, although we are seeing slight increases week over week.
Thank you very much, Dr. Mackie. Let's go to our next question. Mayor Holder, this one is for you, and it's from Jennifer Beeman at the London Free Press. Mayor Holder, will you push the province to prevent a cut to our local vaccine supply? And do you think they will listen?
Well, thanks, Jennifer. That's an important question. As I expressed in my opening statement, I absolutely do not accept a reduction for London. And while I appreciate what GTA and Peel are doing by their very direct and public positioning so that they can deal with their issues, my concern is that if we do not have sufficient vaccine doses here in London, that we'll find ourselves in not too dissimilar situation. You'll recall that N6A for a number of days was deemed a hotspot, and today it is not. But having said that, these numbers change, and what I get particularly concerned about is that they could easily change, and we could easily go back to very dire numbers. It's kind of sad when we imagine that 100 is almost a success, considering some of the numbers of daily case counts. And I mentioned as well, tomorrow, which is today, we will hit the number of 10,000 individuals in London Middlesex who have contracted COVID. That's extremely serious. Will the province listen? The last time this came up of note was the issue of pharmacies. I took the case directly to the Premier. I worked with Minister York as well on this, and I will tell you that they listened. And within the shortest time, we went from 2 to above 40. So I'm hopeful. I will be as expressive as I need to be to get this done on behalf of London, and I can be fairly expressive.
Thank you, Mayor Holder. Next question is for Dr. Mackie. This one is from Jennifer Beeman, and again, it speaks to supply. Dr. Mackie, if the province does move to reduce our vaccine supply, when would you expect these reductions to happen? Immediately, not like next week's 13,000 Pfizer allocation, or further out?
Yeah, so what's happened, Jennifer, we essentially were like, this is the week. Last week was going to be our first week of the reduced allocations, but we received additional allocation for First Nations to recognize the urban Indigenous vaccinating we've been doing. We received additional small amount of allocation for sort of a catch up since we've been behind other municipalities. And so we ended up getting more vaccine last week than we previously had. It was about 18,000 doses instead of the 12,008 that we had previously received, and the 9,300 that was predicted for last week. And then this week is the 1 week where we're seeing that decrease to 9,360. Next week, we're back up to 12,870 again. That's for 2 weeks. And then we actually see increasing numbers. And the supply coming into the province is increasing, not decreasing at this point. So we don't anticipate that any of those predicted numbers will decrease. There's a small chance that they may increase depending on how the hotspot allocations happen. But we're really not seeing a future risk of declining doses coming into our community, at least in the foreseeable. We've got 5 weeks worth of projections.
Thank you very much. Let's go to our next question. This one is from Andrew Graham. Again, Dr. Mackie, this one is for you. Dr. Mackie, I know you won't receive more details from the province until this evening, but do you have any insight on what may be fueling the potential switch from moving to vaccinate the at-risk age group or rather moving to vaccinate the at-risk age group, moving instead to vaccinate the younger age cohort?
I'm not exactly sure where that push is coming from, Andrew. Certainly, age is a major risk factor for death, so I would think that was behind it to a certain extent. We're also just, during this call, hearing that there may be a push to vaccinate early childhood educators. We know there's a political movement among the teachers' unions to get teachers vaccinated as well if there's going to be any other school openings. So all of that is in the mix. And, we're doing our best to be good soldiers, and we've got capacity, and we're going to vaccinate whoever we're directed to. And all of those groups have good, strong justifications. It's not as if there are any groups that really shouldn't be in the queue that are being considered here. So no concerns with any of that from a public health perspective.
The next question is from Jane Sims at the London Free Press. Mayor Holder, this one is for you. Mayor Holder, can you be more specific about the bylaw charges? Were tickets given to businesses or to individuals?
Well, thanks for that question, Jane. I indicated earlier that this was a combined effort of our bylaw enforcement along with inspectors from the health unit, and we partnered with the province. So ultimately, this was a multi-agency blitz. Most businesses were in compliance, which is the great news, as they inspected a number of premises over the weekend. And I can say at this point that some businesses had charges issued. The reason we don't have those final numbers now is that the province is in the process as a way of finalizing the inspection results. And that's part of a process that they go through. I will tell you that bylaw did respond to noise complaints, and in the area around Western, we had 2 illegal gathering charges issued. So those would be significant charges. And from that as well, further charges are pending. I can tell you from a safety of the inspectors, be they bylaw or police for that matter, or health unit officers, one of the things you have to be careful of, particularly when there are large crowds, are the safety of the officers who are involved. That's paramount. So it may well be that the individuals who are gathering may not always or necessarily get the charge, but I do know they look to those who are the organizers, and that's why a little more time is involved in the investigation process so they know precisely who is responsible. But to be clear, more charges will be laid.
Thank you very much, Mayor Holder. And Ms. Young-Ritchie, Dr. Mackie, Mayor Holder, that brings us to the end of our questions for this afternoon's briefing. 9 minutes of overtime, and we just sailed right through it. So thank you all for your insights and for your participation. And thank you for joining us. We will be back with our next virtual media briefing Thursday afternoon at 2 p.m. Look forward to seeing you then. So between now and Thursday, have a great rest of your afternoon, and we'll see you later. So long for now.